Welcome to Sunday Science, where we dive into a few recent scientific articles and their translation into our modern lives. Here is your host, Brent W. Laartz, MD.
All right, everyone. Thank you for joining me on Go On Pro's Sunday Science. Here again, we are having a great springtime. And let me tell you, this is a controversial subject. And I think it's becoming less controversial, but there have been multiple studies bringing out some inherent risks with testosterone therapy. And certainly the theoretical risk of testosterone therapy have been elucidated. Myocardial infarction risk, blood clot risk, and or prostate cancer risk, and or other cancer risks. And so this has been long a controversial topic because there have been multiple studies that are maybe on one side or the other of the fence. Certainly, we do know testosterone decreases with aging, and that occurs at about 0.4 to 2.6% per year. So, if you're looking at the absolute amount, if you go from age 40 to, let's say, 50 or 60 years of age, you're talking potentially a 30% to 50% decline in testosterone. And so the definition of a low testosterone is somewhere between less than 250, and maybe you could bring about a number around 300 to be the low end of normal testosterone. And this is associated with a metabolic syndrome, associated with unhealthiness overall, processed foods, a metabolic syndrome, obesity, and hence we're going to talk about the increased risk of mortality with a low testosterone level of a low endogenous testosterone level. And then we're going to be talking about one of the reasons why there is controversy is there are some multiple studies saying that eunuchs and castration of animals, multiple animal studies showing increased longevity with castrated animals. So potentially, if you have a low testosterone all of your life from birth or whenever they castrated, puberty or just after puberty or whenever these castrations happen, that's a little bit of a different story than replacing a low testosterone later in life, because then you're looking at mortality from there forward, right? Whereas the actual lifespan of an animal, when you castrate them younger at a younger age, that impacts a time frame when potentially there's a really high level of testosterone during youth, and that could impact it. I think that's some of the controversy here stemming from that. And I think if you look at the studies with that, there are multiple studies showing that there is a increased longevity for those animals who never see or very shortly see any level of testosterone in their body and have zero testosterone because they lack the testes or in those animals. And so we'll talk about that. And then we'll talk about testosterone replacement therapy and a few studies there. So, again, the major point here for testosterone replacement therapy is going to be most likely it shows a benefit for aging males, but that there are no randomized controlled trials. And hence, that is what is needed. And we'll be waiting for that to really define a definitive outcome on this. So, all right, let's get to some of the first studies as far as testosterone deficiency and aging and its associated mortality. Let's get to sharing here and let's get our. All right, so here's our slides here we can bring in. All right, so this first study is in the European Heart Journal from 2010. This was from some of the earlier studies regarding testosterone levels. And this one uh, showed that testosterone low levels are associated with an increased risk of mortality in a population-based cohort. So this is a cohort study showing taking men with a normal serum testosterone level versus a low serum testosterone level, less than 250, and showing that there was a hazard ratio about 2.32. So you can see in the dotted line those persons with a low serum testosterone level over the course of about 8 to 10 years had a higher risk of dying, 2.3 times risk of dying. And then there were some other parts to that that showed that cardiovascular mortality and cancer mortality were decreased, were increased as well. And the hazard ratio there also was ranged from about 2.32 to around 3.4, and sometimes up to 5 times risk of dying of those types of illnesses. So that included cardiovascular mortality. Very important because we do have some studies showing that there at least short-term risk of cardiovascular mortality, cardiovascular events, and non-fatal MIs after um, testosterone therapy. The next study is in the Journal of Clinical Endocrinology and Metabolism. So this is a meta-analysis. So meta-analysis takes multiple different studies that they think are valid and appropriately powered, and give them added power by adding them to multiple different studies. So this meta-analysis adds to that. It takes about 12 different studies and shows that most of them by themselves had a pretty good relative risk of mortality with a low testosterone level. And you can see here that there were one, two, three, four, five studies that had some lack of increased mortality. But when you take all of these together, there is still an increased risk of about 1.5 times for having a low testosterone level. This was in 2011. Um, this study is an interesting one from a Maturitas, and this is a very recent study, and certainly this goes at the chicken versus the egg. Which came first? Was it frailty or was it the low testosterone? And which one contributes to the all-cause mortality? Because if you take a low testosterone in a male, potentially they might, if they are not having some resistance training, et cetera, to counterbalance that, they might become weaker. And this showed that mediated the frailty portion, mediated 35% of the increased mortality that was associated with the low testosterone levels. Um, and so this basically was an interesting study that suggested, what if we take a person with low testosterone and instead of increasing their testosterone levels, what if we increased their resistance training and decrease the amount of frailty that this person had? And perhaps there was, and we already talked about the fact that testosterone low levels are also associated with having these metabolic syndromes, unhealthy living, which are also going to contribute to illness and then frailty, which could then lead to all-cause mortality. But all right, so the next thing we're going to talk about is the actually, before we get to that, let's talk about the eunuch and castration studies. There's a study from Korea, and in Korea, they had certain individuals many years ago, and going back actually a couple of centuries, had been castrating and creating eunuchs for various reasons, whether it's religious or not. And this study showed that these eunuchs actually lived a significant amount, 10 to 20% longer than their cohorts. However, the problem is they identified about 385 or 400 eunuchs, and they only were able to get lifespan information on 85 of them. And is there a reason why they were able to obtain the lifespan um, for those 85 versus the other 300, let's say? And there might have been a reason for that. Maybe because who knows whether that those individuals they were able to find were more likely to die earlier, or whether they might be opposite. Maybe they would live longer. But then there was another study in Poland showing an institution. I think it was an institution of some sort, like an institutionalized individuals, mentally retarded or otherwise, and they castrated them and showed that, and there was a study that showed that those people also lived to be about 10 to 20% longer than their cohorts in the same institution. So that is a little bit valid in the fact that it's the same institution and it's cohorted. And then there are multiple animal studies showing castration of animals and their increased longevity. Um, I had so these animals and these go from different animals, from dogs to rabbits to other mammals. So, again, here's the difference here between this and what we're going to talk about hormone replacement therapy and these other low testosterone level. Um, the low testosterone levels we were just talking about, these persons had a low testosterone level after puberty, into aging, into, midlife and into older life. So that's a little bit different than these animal studies where they're castrating them before their reproductive years. And that could impact their survival, perhaps that high level. What does that high level of testosterone do to them? And that certainly, and there's a pleiotropy theory for this, that those individuals are with the testosterone are gearing toward reproduction and are not necessarily gearing toward survival in their cellular levels. Um, and okay, so now let's go to the testosterone. Here's a study from 2012, one of the also early studies where it showed that untreated versus treated low testosterone levels had decreased mortality. And you can see there it's about 10% decreased mortality. And the hazard ratio on that, let me get to that study. I don't have the hazard ratio, but check out that study. All right. So again, you can see in the top level of this survival here curve where the two curves are pretty similar during the first 12 months. Is there something that's going on with that? Why the survival is not any different? Because there's probably no statistical difference between those, and the statistical difference doesn't come about until you get out to here to the 36 to 48 months. And this will be important because I think that there is some difference here, and I'll get to that in one of the next studies here. But here is a study that's very interesting from 2015 from the European Heart Journal. And you can see here that um, this is showing testosterone treatment in the blue versus the normalized treated. And you can see that the mortality is different between the two in a untreated versus normalized treated in the upper left. So this is somebody who was treated in the red, who had a low testosterone and was treated, and their testosterone level increased to a normal level. And and this is a cohorted treated study, and there are some biases associated with this. And this is one of the reasons why they separated these. And the bias would be potentially those that are treated might be more likely to have benefited from a healthy bias in the fact that they made it to a doctor, and they made it to that doctor, and checked their testosterone level and got it treated. And so they may be more aggressive with treating their illnesses and or treating their preventive, having their preventive, other preventive care taken care of. So here again, then you can see on the right, though, this can take care of some of this bias because here you can see the non-normalized treated versus normalized treated. You can see that the mortality curve, again, is different, even in those who are treated. So these are people who are receiving testosterone, but their testosterone levels did not increase to above the normal or into the normal range. So normalized treated, again, the same curve as was to the on the upper left, and this is in B here. You can see that there is a difference in mortality there again. Or at the bottom in C, you can see this is untreated versus non-normalized treated. These curves are almost exactly the same over that course of that 14 years of follow-up. A very important cohort study there. Again, not a randomized controlled trial. So one would need that to show this here. So we talked about the fact that there are a few studies showing increased risk of myocardial infarction after treatment with testosterone. And this study, which was from the Lancet Diabetes and Endocrinology, um, showed that if this is separating out the controls in blue versus the amount of time somebody had been on testosterone and what the mortality difference there. So if you had been only on testosterone for 2 months, you were in the red curve. Actually, it looks like there might actually be an increased mortality compared to the blue line. And then if you had been on testosterone for around 9 months, and this is the tertile 2, it's about the same mortality. But if you had been on testosterone therapy for 3 years or more, and the average was from anywhere from 2 years to 5 or 6 years, and this is going out to about 10 years here, 8 to 10 years, looking at this mortality, and you can see there is a clear difference in the mortality difference between both controls, tertile 1 and tertile 2. And you can see that if they had been treated for 3 years or more, that there was a definite mortality difference. And perhaps that could be, there's multiple reasons for this, but this just shows that there is some teasing out to this that is needed for a randomized controlled trial. Certainly when you first start treatment with testosterone, you might have some changes going on and there might be some clot risk, etc. We don't know that. And this this could be that portion here where if you're only treated for a couple of months, you might be at risk of having some adverse events. All right, so all right, those are our few studies we're going to share here. Just showing something to think about with regard to our role in bringing about increased longevity. Does testosterone absolutely decrease mortality? Testosterone replacement therapy decrease mortality? We don't know for sure because we do not have that randomized controlled trial. So again, let's think about this in the long run. We do know that low testosterone levels increase mortality if they're low. And if that is the case, and we do have some studies showing decreased mortality with testosterone therapy in randomized and in cohort trials, etc., then I think the time is now that we need a randomized controlled trial. And I think that that would be beneficial for all of us who have all of these questions regarding this. So let's let's think about this and certainly each individual, there's an N of one, right? N of one, each individual is different. Each individual has different risks, family histories and family histories of prostate cancer or personal histories of prostate cancer for that matter, and or risks of heart disease and or obesity and those things that could impact other risks that could be associated with testosterone. And again, always with Sunday Science, seek medical care, get to your function health doctors, get to your own physician who can help you with these questions regarding that. And certainly an interesting set of studies here that we can draw upon to answer those questions for most people. Then again, these are cohort studies that are population. They may have 500 people, they may have 1,000 people, they may have 2,000 people. That doesn't necessarily mean just because the average did better that everybody did better, right? So again, that's why the N of one. That's why checking your levels, checking your testosterone levels, checking all of your different health parameters, and getting as much information as you can to get your health snapshot on a yearly basis or more often if you need to. I certainly do, and thank you very much for joining us here. Quick Sunday Science. Again, look for us on different media, either YouTube, Spotify podcasts, and look for us uh, on Apple Podcasts. Look for us on our social media. We are available out there. Also on goonpro.com. We have all of our information set there. Thank you very much for joining us, everybody.
This site and any information communicated within it are not intended as medical advice. The information herein is not intended as medical care, diagnosis, or treatment of any medical condition. No component of this content, including discussion or comments, shall be construed or implied as establishing a doctor-patient relationship. Before you translate or copy any of the information, diet, exercise, or products utilized herein or on any social media post to your own practice, consult your own research, physician, therapist, or nutritionist for your own health. No warranties or claims are made as to the benefits or risks of any treatments, diet, exercise, or products herein. Research any treatments, diet, exercise, or products thoroughly before trying for yourself. Referral, affiliate, or advertising fees may be garnered by this site.